All right, I think we're good. We're live here on Facebook. Hi, I'm Sally Flashberger. I'm with the Wisconsin Board for People with Developmental Disabilities, and this is our Living Well Monday presentation, but we're doing a special state budget presentation today. So we're excited to have you all here. If you're watching us on Facebook Live, please post any questions in the chat. And if you're joining us on Zoom, please stay on mute if you can. If you want to turn your cameras off, that's great. And you can also post any questions in the chat. Tammy's going to answer questions at the end. So go ahead and put them in the chat, and then we'll go through when we get to the end of the presentation. So we're really lucky to have Tammy Jackson with us today. She's our policy analyst, wonk, policy extraordinaire at our agency, and she's done all the research and looked into the budget, and she's going to tell us what is in the budget related to people with disabilities and how you can advocate for what is important to you as we walk through this budget process. So I'm going to turn it over to Tammy.
All right, hello friends. I'm glad to be with you today, and there's a lot to cover. So welcome to the exciting budget process that happens every 2 years, in which we decide what to spend our tax money on. I'm anticipating I will make some technical errors in terms of moving through my slides, so please bear with me if that happens. What we're going to cover today, we're going to cover what is in the initial proposed budget that the governor has submitted to the legislature. And there are lots of things in this budget that impact people with disabilities. These are just some of the topics that our state budget covers. And there's definitely things in this budget that impact people with disabilities in all of these categories. A little bit of an overview. Why is the state budget important? I just said that it's something we do every 2 years. And when you think about all the things that might impact your life, much of it relies on funding provided by the state. Whether you're driving on a road that has some amount of state dollars that went into making it, or if you rely on long-term care services like Family Care or IRIS, lots of times there is a proportion of state funding, which is gathered from all of the taxes that we all pay collectively, that goes into maintaining those programs and services and making changes to them. The budget is important because it determines where we are investing those dollars. How will we be spending the money that our state has on the things that benefit the citizens of the state and that many of us rely on or use? County government services, local government services, public education, Medicaid, corrections, universities. These are all big categories that rely on lots of money that we all contribute and that the state decides how to spend. There are some changes in a budget that might impact how those programs run, who's eligible to be in them, those types of things. And or make other changes that don't impact how much money goes to the program, but can be important, and they can be positive, or sometimes they can have unintended consequences for people with disabilities. So there's a lot to watch in terms of what is in the state budget, and is it a overall positive impact for people with disabilities, or are there things that we want to make sure folks know, before they happen, that they can reconsider. This is kind of a big graphic about what does the state budget process look like. And I think it's especially important this year. We're going to be talking about really the initial step of the budget process. The governor in this state is the person who puts together their ideas of what they think the budget should look like. And that is what was released on February 16th and what this presentation does an analysis of. So when we're talking about, what the budget includes, we're really talking about what did the governor think was a good idea? What are the investments the governor thinks should be in the budget? And the little highlighted section there is the next step in the process. The next step is the Joint Finance Committee, which is a committee of 16 legislators in the state, receives that budget and now decides what to do with it. And the Joint Finance Committee can add things to the budget that aren't there right now. They can change things that the governor proposed, or they can remove things that are in the governor's budget. So part of what we're discussing today is if there are things that you think are really important that are in the governor's budget, you want to make sure that your joint finance members and your legislators understand that those things are important to you and people in your life, and should stay in. If there are things that are missing from the budget that you think should be added, that's another thing you can talk to your legislators about. And maybe there are some things that you don't think are particularly worth investing in, that you might say, I think these priorities are more important to me and these aren't. That's really what you're doing, is trying to help your legislators understand what are the things that are going to most impact and benefit your life. Those are the things you want included in the budget, right? I just got an email this morning. The Joint Finance Committee typically has held public hearings on the budget, and they've traveled to different locations in the state. They just released their schedule for that this morning, and it looks like there will be 3 in-person sessions in April and 1 virtual listening session in April. So that is a great opportunity for all of us to communicate directly with Joint Finance and talk to them about what are your priorities in the budget. I won't go through the rest of the flow chart, except to say that this is a long process. The budget has to be passed every 2 years. It's the only bill that actually has to be passed, and the deadline is technically June 30th. That's when the budget's supposed to be to the governor to be signed into law. We're anticipating this year that, especially as COVID-19 continues, that this process will be maybe a little bit slower, and it definitely will require folks to be continually engaged multiple points in time. This is not a spectator sport. Oftentimes, as legislators are considering what should or shouldn't they spend money on, they have lots of people talking to them all the time. And our voices need to be part of the groups of people who are talking to them all the time to make sure that things that are important to our community are also reflected in the state's spending plan. So again, I'm going to go through some of the things that are in the governor's proposed budget, and just kind of talk about them from a perspective of why we think these things are important to people with disabilities. Over the last year, the governor actually had a task force on caregiving that really focused in on what the workforce crisis. Many people with disabilities who rely on long-term care supports for things like getting out of their bed in the morning or getting to a wheelchair or daily activities like bathing or dressing or meal preparation, rely on many workers who come into their home and sometimes family members to help them with these tasks. And over the past several sessions, it's become very clear that there is a crisis in the number of workers who are available to provide that kind of support that helps people stay in their homes. And families provide a lot of that support themselves as well, often unpaid. So this task force the governor created was really trying to come up with recommendations on how do you help both family caregivers and paid workers stay in those roles to make sure that people are able to be in their homes and not sent to an institution where they may not want to be, but might be the only place where there are people who can provide that level of care. Many of the items, actually all of the items that are included in the governor's budget are coming from the recommendations of that task force. So I'm going to just summarize, quickly, top line, many of them. For family caregivers, the governor's budget expands the family medical leave. Is available. It's unpaid leave. If you are employed, you can take unpaid leave to care for certain kinds of family members. And right now it's restricted to, I think, children and spouses. So this provision broadens out who you can take that kind of unpaid leave for, which we think is a benefit because, as we all know, the more people there are in your network who can take some time to provide care, the more the less the strain is on any one given caregiver. It's also very clear that there are lots of family members who are providing care for people who are not necessarily their children or their spouses. And so we think this better reflects the reality of many people's lives, that there are lots of people who are doing a lot of work to provide care to folks who might be, a slightly different relationship than what is covered currently under the law. So that's a big deal. Also, to help family caregivers, lots of folks who have been hospitalized may have had the experience of, being released from the hospital and the caregiver doesn't know what to do. This has been a continual issue that advocates for older adults have advocated for. So there's a provision in the budget that would really require hospitals to allow people to say, hey, here's the person who, when I leave the hospital, is going to be providing care, and I'd really like them to know what to do. I'd like them to know my pill schedule. I'd like them to know what your expectation is in terms of wound cleaning, or any of the other things that might be important to avoid being rehospitalized. Another important provision, aging and disability resource centers already do a lot, but they don't necessarily, right now, they don't necessarily support family caregivers who are under the age of 59. This would help ADRCs provide more support to more family caregivers, especially those who are caring for younger people with disabilities. Lots of times ADRCs are the first place that people go. There's one in almost every county. And this budget is trying to recognize that there really needs to be a resource for family caregivers to help them figure out how to do this role, in addition to the other roles that they may have in their lives. The caregiver tax credit piece, this was actually a piece of standalone legislation last cycle, and it's intended to be a gesture, really. It's not, many family caregivers actually spend a lot of out-of-pocket money in that role. When you think about transportation, family members may be providing, all sorts of different types of expenses sometimes go along with caring for somebody else. And I think AARP said that, in some cases, you're maybe $6,000 to $7,000 a year might be about what folks figure they spend in the service of others as they're caring for them. So this is a provision that's trying to recognize that contribution by providing a income tax credit for some of those expenses. And it's limited to $500, but it does acknowledge that this is a real role, and that people are really contributing not only their time and their love and their caregiving, but also their financial expenses to help people stay where they want to live. Another recommendation from the caregiver task force. This is a pilot program to try and provide better support for family caregivers. Lots of times, you know, people are very willing to provide care, but they can't always provide the same level of care, you know, for an undefined amount of time. So caregiver burnout is a topic that is a phrase that gets used a lot. And this is trying to figure out, like, how do we make sure that our family caregivers who are providing such excellent level of care can be healthy enough themselves to continue doing that role? And when do we have caregivers who need extra support, or, you know, to be able to continue a role in a different way? And when is the point where, you know, somebody is a family caregiver and they really need to take a step back and do things really differently? This is a pilot that's trying to help figure out how do we make that assessment so that people who are family caregivers can continue to provide care and remain healthy themselves. This was also a standalone bill, not only last session, but this session as well, supported by the older adult and disability advocacy community. Many times there are times when both people with disabilities and older adults may end up having some or all of their civil rights to make their own decisions removed by a court and transferred to a guardian. Guardians, unfortunately, aren't necessarily trained on what their role is, what they can and cannot do, and how to do that role. And it's a big gap that is really challenging, especially for family caregivers who often unexpectedly end up in a role of guardian. So this provision is trying to help make sure that people understand what the role of a guardian is and isn't before they are actually appointed by the court and required to do all of the reporting and paperwork and other things. All right, we're moving to the paid caregiving workforce now. In other sessions, including last budget, there have been some big increases for the workers who are paid to come into people's homes, often associated either with family care or IRIS, which are home and community-based long-term care programs, and also this impacts nursing home employees as well, workers who are coming into institutions to provide care. Direct care services do a lot of things for people in the home. And there is a pot of money that is proposed specifically for family care that would help increase the workers' wages. In family care, the way workers are, family care is a Medicaid funded program. And the way Medicaid works is that it pays a specific dollar rate for a service. So there is a dollar rate for direct care services, and direct care service agencies receive that full rate. They need to take off administrative costs for their agency, and then the remainder of that funding goes into workers' wages. So this money is to raise the rates that agencies get paid, and then there will be an increase to workers' wages, because of that rate increase. It is unclear if you are an IRIS participant how this money may or may not be helpful to you. The way the budget is phrased, it does say like it's supposed to be for long-term care programs, which includes family care, IRIS, and nursing homes. but it isn't clear about how much money goes, like it doesn't say, well, this is how much money should go to each program. And of course, IRIS works very differently. People who are in IRIS pay are the employers and pay their own workers. So they are themselves are not an agency. So that's, you get an overall allocation for a budget that you can have some flexibility of moving, your budget from service to service. But you are not necessarily, as the employer, responsible for all the payroll taxes, all the things that a provider agency is for an employer. So it is really unclear to us how this works for IRIS participants, and I anticipate that will be an item that will be discussed with the legislature. The other big increase is for personal care services. Many people in long-term care use those, and these are usually paid for on your Medicaid Forward Health card. It's specifically to try and raise the rates so that folks who provide personal care services through personal care agencies can benefit from a raise. Again, in IRIS, there are lots of people who hire workers who are not affiliated with a provider agency. So if that is the circumstance, it is unclear to us how this increase will benefit IRIS participants who are needing to hire non-agency workers. And to give an example, like in many areas of the state, lots of folks are in IRIS because there aren't enough provider agencies. So they are hiring workers, maybe neighbors, maybe people they know in the community to do this kind of work for them. But those folks are independent. They're not affiliated with the agency because there isn't one. So that's a kind of example of, okay, we're not sure how this money would actually help that IRIS participant give their worker a raise. A few more items. The governor's budget would create 4 project positions to help speed up and conduct the background checks and other things that are required for workers in licensed residential settings. And it would establish a pilot to create a home care registry, which is essentially, I describe that as like a dating service. It's almost like a dating app, right? Where you have workers who would like a job and you have people who would like to hire workers, and you're trying to find a match. That's the idea of a registry, is to try and help people find each other to make a good match between worker and employer, and also to help streamline how provider agencies are able to efficiently schedule their workers. Certainly, there's a lot of advantage if you have workers traveling from home to home to make sure you have workers where they're having an efficient route and that their schedules are compatible. There are also some elements that are directing our Department of Health Services to develop some training. One of the comments that the Caregiver Task Force hears about a lot is a need to fully value and make sure that there's a professional career path for folks who are looking at caregiving as a professional career. So this is a direction to the department on how and to do that, which hopefully will lead to more workers staying in the workforce and perhaps getting into different roles and more experienced or more positions that have more skill that they could be paid more to do. There are a couple of provisions with regard to children with disabilities. The governor's budget inserts some language that is intended to say any child who's eligible for the children's long-term support waiver receives services. Advocates point out that this is a good directional and value-based statement, but we do not see that there is any money that would necessarily follow to ensure that eligible children have are funded. We do not see that this is what we call some sufficient funding. In other words, that however many children need services, there will be state and federal dollars provided to fund whatever they need. We don't believe that that is in fact what would happen with this provision, but it is important to deliver the intent that we certainly want to make sure that anybody who needs long-term care services in the children's system does get them. A couple of provisions with regard to lead exposure. Some of these are actually a big deal. Lead is in a 100% preventable cause of intellectual and developmental disabilities. And unfortunately, many children are exposed to lead either through lead pipes that are carrying water into their homes that have not been replaced, or through old paint chips, that lead-based paint chips that are still in many older residential settings, even if they've been painted over. So for folks that have been exposed to lead, this would make sure that they have access to birth to 3 services. So a pathway to kind of evaluate if there are delays and what to do about them. And also it provides a boost in funding specifically to try and renovate residential settings that may have lead in their paint or other surfaces, to try and make sure that people aren't getting lead poisoning from where they live. Oh my goodness, education, okay. Lots of things to talk about in special education. Last budget, we did receive a boost in the amount of money school districts are reimbursed. They spend their money first, and then the state cuts them a check for a part of what they spent. And the reimbursement rates have been fairly low in this state for a long time. So schools are required to spend whatever they need to cover the costs of special education students, and then they get part of that money back from the state. But it has been a pretty low rate. This would significantly, I think we're at 28% is what the current reimbursement rate. So for every dollar that gets spent, 28 cents is what the state pays the school district. This would raise it to 45% in the first year and 50% in the second year of this budget. And I think that's a change advocates have been saying we really should be reimbursing it to cover at least 2/3 of the cost of special education. So raising it up to 45 and 50% would be significant progress towards that goal. It costs about an average of about $13,000 to educate a special education student, but there are some students where that cost is significantly higher. And those are our high cost special education folks. These are students where the cost of educating them per year is $30,000 a year or greater. So the budget also contains a increase in the reimbursement rate for those students. That's pretty significant. And increasing the special education reimbursement actually really helps the general education, the money that is there for general education. Because often when school districts who are required to cover the cost of special education have to do so and then don't get enough money, they end up having to kind of scrimp and save in other parts of their budget, which includes just general education students. There are a couple of pieces, and we saw this in the last budget as well. There's a real push to invest in student mental health and wellness. So I think especially with the pandemic that's happened in the last year, many folks are wondering if there will be an increased need for services, certainly in the next coming school year, which we hope will go back to in person, that there's been a lot of students that have had some real challenges in the past 18 months, and that there will be an adjustment period in the next, starting with the next school year. So this kind of investment in mental health and wellness is, needed anyway, but possibly even more more germane now. The governor's budget also makes some changes to the parental school choice, the special needs scholarship program and school choice programs. The first thing it does is try and increase what you need, what do you have to do to be a teacher in a special needs scholarship program or parental choice program school. So right now, I don't think you need to have a license from the Department of Instruction. This provision would say, yes, you do. You have to be a licensed teacher in order to teach in those settings. There's also a provision that would require information about, okay, how many people, if you go to a non-public school that takes funding for that student out of the public school system and puts it somewhere else, what is the impact on property tax bills and your school district when that happens? Here, I knew I was missing something. The other changes with regard to education, the total number of slots or spots available for special needs scholarship programs, and that's where the state pays part of the cost for a special needs student to go to a private school. That's what the special needs scholarship program is. This would limit the number of spots that are funded by the state, for the next 2 years. So it would not necessarily continue to be unlimited numbers of spots. And the last education piece is an increase in the transition readiness grants. This is a pay-for-performance approach that helps school districts who are really working hard to make sure that their transition age students are ending up exiting school and getting into a job or getting experience into jobs. It's kind of a bonus payment for, hey, you've been successful with these students, and now we'll give you a grant, a grant back to your school district for doing a good job. So it's a welcome addition to a program that was established in the last couple of budgets and seems to be doing quite well. We're moving into healthcare and Medicaid. Once again, we call it Badger Care expansion. The Badger Care is the sometimes thought of as the Medicaid program for able-bodied adults, but there's actually lots of people with disabilities who are in Badger Care, including some people with intellectual and developmental disabilities who perhaps are too functional to qualify for. There's a functional screen that helps people understand whether they're eligible for family care and IRIS. And some people do not pass that functional screen and have to find a different Medicaid program. And Badger Care is one of the places they end up. Many people with mental health disabilities are in Badger Care, as are people who are waiting for a disability determinants for, say, like the Social Security Disability Administration, and also people who have chronic conditions or intermittent disabilities that come and go. The other big population of people who rely on Badger Care for their healthcare insurance are a lot of our paid caregiving workforce. Because they are not paid, the rates that our paid caregivers are paid is not high. Many of them actually end up qualifying for Medicaid funded healthcare and end up in Badger Care. And because Badger Care has pretty strict rules about how much you can earn and how much you can have saved in, say, like a bank, lots of those workers are kind of in a pickle and have to either reduce their hours to make sure their income is low enough to keep their health insurance. So Badger Care expansion is really about changing where that line is on how much you can earn and still be able to keep your Medicaid health care. Right now, you're at 100% of Badger Care is limited to people who have 100% earn 100% of the federal poverty level, which is roughly about $1,000 a month. I'd have to look it up right now. And this would boost it to, you could earn up to 138% of the poverty level and still access Badger Care for your Medicaid health insurance. There's also a number of other healthcare changes that we didn't pull out in detail here that are designed to help people who maybe earn more than 138% of the poverty level, but also need some assistance to pay for premiums if they have to purchase their healthcare on, say, the exchanges, if their employer does not provide their healthcare. There are a number of increases in various Medicaid rates. Remember when I talked about the direct care rate? There are rates for every type of service in Medicaid that you receive. There's a rate that is set, and that's what the provider receives for providing that care. They get reimbursed a certain amount of dollars for providing a specific type of service. So these are different services within Medicaid that have all gotten a rate increase. Autism treatment, speech language pathology, audiology, child psychiatry, and medicated assistant treatments. Lots of these are things that people with disabilities might use, which is why we're highlighting them here. No. Another piece, this was a piece of standalone legislation last year and this year as well. Many people with disabilities have the same pickle our caregiver workforce has, where they really need the health care that is really available only under Medicaid, or they need the long-term care supports that Medicaid provides. But those programs have income and asset limits. So lots of folks kind of feel like they would like to be earning more or saving more, but they can't do so, because if they do, then they lose the ability to participate in programs that are really, really critical to their daily lives. So one thing the federal government did is pass a law called ABLE, shorthand, that allows people with disabilities and their family members to set up a special kind of account, kind of like a 529. It's a 529 is the tax code, but it functions very similarly to the EdVest accounts that some people may be familiar with, where you can set up one of these 529 accounts and contribute money to it, and it won't count against your income or your assets when it comes to determining whether or not you're eligible for Medicaid or Social Security. And that money that's contributed either by the person with the disability who's earning their own funding, or by folks contributing to that account that are not the person with the disability, that money can be used for a pretty broad set of qualified expenses related to that person. So it's a really nice option, but nobody really knows about it in Wisconsin because our state doesn't have an ABLE program that it administers itself. You can get all the tax benefits as a citizen of the state, but what we found is people don't know that. And so many folks are, if they know at all to ask about how do I set up an ABLE account, they actually have to end up looking at other states, and it's really challenging for them to figure out what's the best option for them. So the governor's budget would basically direct the Department of Financial Institutions to either set up our own program in Wisconsin for Wisconsin citizens, or to contract with another state to administer accounts for people in Wisconsin. And there's lots of examples of states that actually have set up their own programs and have contracts with states and work with other states all the time to make sure that that is really easy for Wisconsin citizens to set up an account and understand how they can use it. In terms of disability employment, there are a couple of things. Many of you may be familiar with Project Search, which is a training and placement program. It's worked very well. It's a good program, and this budget would transfer some additional money into that program. There's also a provision that would help draw down additional funds for DVR. I think it would add one position to DVR, and there's some expansion of an existing program to make sure that disability owned businesses are included. Mental health, there's a lot of stuff associated with mental health. So like some of the Medicaid issues that we talked about, many mental health services are also reimbursed. So you have a provider who provides service and then they get paid after they've done that service. Some of these provisions are about rate increases and who can bill for these services. So when we say expand the psychosocial rehabilitation benefit, this really means that we're allowing more different types of providers to bill for that service than right now. There's a provision to increase the number of beds, the capacity to serve at the Mendota Mental Health Institute. Again, expansion of a couple of existing programs for different populations that are designed to support their mental health, farmers and veterans in this case. Regional crisis facilities. This has been a big ask for advocates for a long time. Currently, Winnebago Mental Health Institute is where folks who are getting involuntarily committed under Chapter 51 are mostly sent. And there's only one of those, and it's in Oshkosh. So it's a real disruption for people who live pretty far away from Oshkosh to be sent, all the way to Winnebago Mental Health. It's expensive to do it. So regional crisis centers have been something that advocates have been asking for some time, partially because we think smaller settings are overall a better option, but also because that cutting the amount of travel time and the amount of disruption in a person's life is important to their mental health recovery. So that is something that is in this budget. There's also increased funding for a number of existing grant programs. We hear a lot from people with intellectual and developmental disabilities and family members who are worried about, well, how will law enforcement understand what is happening if my person is having a mental health crisis? How will they know how to not make that crisis worse? Increased funding for the type of training that we would hope would prevent that situation. Additional money for phone line support at peer-run respite centers and emergency response funding. Again, these are existing programs that are getting a boost in the amount of funding they receive, which we hope would lead to a boost in the amount of services that they can provide. Examples of 4 other existing mental health programs that are all getting a little bit of a boost in terms of funding. And substance disorders. There are certainly people with mental health disorders who have substance disorders too. Many people with disabilities have co-occurring substance abuse or mental health disorders. So we're including all of this stuff in here because people are complex and they often have complex needs. Overall, increases to these programs do benefit people with disabilities who have these co-occurring conditions. Many folks, many people with mental health issues and disabilities end up touching the justice system. Again, these are existing programs that are receiving a funding increase for folks who are currently incarcerated. The ORS program really is designed to help them re-enter society successfully. And certainly that is a challenge, especially if you are dealing with disability or mental health issues, in addition to just coming back, re-entering from an incarcerated situation to the community. Treatment alternatives and diversion for lots of people, especially those with substance use disorders. They may have a brush with the law that perhaps prison or jail isn't the right solution. And the treatment alternatives and diversion program, it enables judges to kind of figure out a different plan that holds the person accountable, but doesn't necessarily send them to prison. And this is a program that's been expanded a number of times and is fairly popular and successful. For many people with disabilities, their engagement in the justice system begins early. Advocates have long been concerned about students with disabilities perhaps being, behaviors sending them into the juvenile justice system. There are some important provisions that would once again propose changing the age at which people are considered adults for adult court from 17 to 18, and the minimum age of delinquency from 10 years to 12 years. Eliminating the serious juvenile offender program at DOC and increasing the youth AIDS funding, which is really trying to help boost our investment in kids that have engaged in the juvenile justice system. Kind of the last thing I wanted to cover for us, there's some exciting developments in internet connection and access. And I would say that 2 years ago, we probably wouldn't have had this issue on our radar as a disability issue. But since COVID, it's been really clear how important robust, affordable internet connection is for everyone. Many people with disabilities during the pandemic have either not had any connection to internet at all. In some residential facilities, there really isn't a communal place for internet, and maybe people don't have their own personal devices that can connect to the internet. So for those people, they've been without a lot of the things that have helped the rest of us continue working and participating in the community as much as possible. For folks that have had access to an internet connection, lots of people with disabilities have found that things like telehealth or virtual services have been very beneficial. They've been able to schedule specialty appointments and avoid traveling long distances because they can do them virtually as opposed to go in person. Many times people have been meeting with their care teams if they're in a long-term care program virtually, which is again a change from having to do so in person. Lots of our folks with disabilities are non-drivers, so anytime you can make it easier for somebody to get somewhere, it's a benefit. I think the other pieces that we've seen really be helpful to people with disabilities, banking and a lot of e-commerce and government services are transitioning more and more online, as are jobs. Lots of job opportunities are only posted online, and if virtual work becomes a thing in the future, these are all things that people with disabilities can really benefit from. But they can only benefit from it if you have that affordable connection to internet. And the governor's budget does do several things that are intended to not only increase the amount of infrastructure to boost the actual connection, but also make it more affordable. So the budget, the governor's budget would create a special program to make sure that low-income households who need some assistance in paying for those internet subscriptions can get a subsidy to do so. It also tries to reconcile that a lot of homes, the broadband infrastructure may be there, but the connection from the infrastructure to the actual home where it's used may not be there. So it's kind of like building bridges from the infrastructure to the individual users. That's something that is included here. The governor's budget also asks to make sure that we have a real good picture of where there is and isn't coverage. One of the things we found in this pandemic is that we used to call rural broadband. It's not rural broadband. There's plenty of people who don't have enough connectivity who live in urban or suburban areas too. And I think we don't always recognize that and know that. And certainly the more people who are trying to access the internet, the more capacity you need for that. So this kind of mapping is a helpful tool to kind of understand, are we really providing enough connection for the amount of users and use that's happening? There's some consumer protection pieces in the budget, so that you wouldn't be able to be denied internet service on the basis of income or race. And in terms of actual physical infrastructure, not only do we increase the grants that have been typically used to build more broadband connections, but it also welcomes in municipalities, your local governments as being one of the people that should be allowed to apply for those grants and to develop their own systems, especially in unserved and underserved areas. The other piece it does is allow electric cooperatives, which are pretty widespread in at least the rural parts of the state, to be a player in who is able to connect to and administer broadband. Two pieces related to voting were included in the budget. Many people with disabilities have a lot of challenges when it comes to getting registered to vote. Often you need a photo ID, and you may need to travel to a Division of Motor Vehicles site to be able to get that ID. So automatic voter registration is seen as a way to make that process easier for lots of people. And it restores, there's two things you need to be able to vote. You need to be the right age, 18 or above, and you need to be a resident of the state. And so residents, the amount of time you have to live here before you are an eligible voter is the residency requirement. Right now it is 28 days. So you have to live in a specific location for that amount of time before you can vote. This would change it back to 10 days, which is what I think it was before 2020. So that's helpful for a lot of folks who may be renters and may move quite, on a frequent basis. Overall, there was one other slide I think I might have skipped in my mouse misbehaving on transportation. There are a few elements that are really increases in existing programs. Transit got a boost. The amount of money to replace transit infrastructure like buses got a boost, as well as paratransit and specialized transit. Those are all existing programs that got an increase in funding. There's also a provision that's intending to encourage more regional collaboration, so we don't have folks that have a challenge getting over their city line or their county line boundary. But it's less that's less of a tangible provision in here. So I've talked a lot about what's in the governor's budget. And remember, when we were first talking, I said this was going to be a long process that was going to require continual engagement on your part. How do you do that over the long haul? Because the governor's budget is the first kick at the can. And now the legislature gets some kicks at the can. And if there's stuff in here that you like or think that's missing, or think shouldn't be in there, this is your opportunity to let your state senator and state representative know what you think is important to people, to you and to your family and to people with disabilities. So you can always contact your state senator and state representative with your budget priorities. Many of them have what they call a budget buddy on the Joint Finance Committee. So it is important for constituents to reach out to their own members, whether or not they're on the Joint Finance Committee, because the legislature does take a temperature amongst its colleagues about what are they hearing about collectively. You can look up your legislators by going to the legislative website and just typing in your address, and it'll pop up who your state senator and state representative is. The second thing you can do is attend a joint finance hearing, and we'll have to update our presentation because now we know when they are in April as of this morning. And if you can't attend a hearing, you can send your comments to the Joint Finance Committee using that email address. The other thing that are helpful for folks to do, most of your elected officials will have some sort of social media pages, Facebook or Twitter. And it's good to like those pages because you'll get information about them and what they're thinking, and also an opportunity to engage with them on those platforms to talk to them about your budget ideas. We are having a virtual disability advocacy day this year. It will not be in person. It is March 23rd. So look for more information on that. That's yet another way to engage with your legislators on the budget. Also, just new this week, the governor is holding another round of listening sessions. There will be some federal money that is coming in to Wisconsin from the COVID relief package that has just passed. So there may be more funding flexibility to fund more things that people think are important. So we're going to encourage people to, engage with the governor's sessions too, because we're not really sure who's going to end up having authority to spend that block of money. And it could be that you have opportunities in the budget as well as opportunities to invest in people with disabilities using COVID relief funds. When you are making a contact with your legislator, it's not complicated. You can all do it, but make sure you tell them your name and where you live, because they want to hear from people who are living within their districts, and just a few details about your life. Lots of legislators may know a few people with disabilities, but they don't necessarily know you or your family situation. So it's always good to give them a few sentences that kind of puts you into context. And then you want to be clear about what your priority is and how your experience says that this is a priority for you. And then you always want to ask them something. So make sure you are clear about, hey, I think this is important and I want you to support it. Because you don't want to just give them information. You want to make sure that they know what to do with that information. If you were looking to do a deep dive into the budget, there is a link here to the budget in brief, which is a summary of all of the items in the budget. We only covered a few of them, even though we've been talking for almost an hour. We pulled out the disability highlights, but there's always a lot more than just disability issues in a budget. So you could go read that summary for all the state agencies about what is included in the governor's budget. You can also go and look up the budget bill, and you can look at the policy priorities that our disability organizations, BPDD, DRW, and the ARC Wisconsin put together for this session. Many of the things that we wanted are reflected in the governor's budget. And we do think that there are lots of legislators who see those as priorities as well. With that, I'm going to stop sharing my screen and hand it back to Sally.
All right. So not too many questions. I did see a question about, was there any information on, was there anything in the budget related to housing for people with IDD? And, you know, talking about there's over 4,000 people who are still, you know, trying to find housing. So anything that maybe was in the budget around that.
Hold on, let me click around. My first reaction is there is not anything that is specific to people with disabilities and housing. Lots of folks who get housing assistance, it's actually a federal program that does that. There are some increases that older adult advocates are pointing out as helpful to WIDA, but I don't believe there's anything specific to people with disabilities.
Yeah, and it was kind of around like, is there any grants for new like housing developments or anything like that? So
no, that I
okay.
can say with authority.
Yeah, we had some great
WIDA.
interaction about ABLE and 529. So thanks for whoever posted that. But not really too many other questions. Not sure if you know, if there's any questions, if anyone wants to post in the chat. I think you did a very thorough job, so that's always great to have all that information. We did post a link to the PowerPoint in the chat on the Zoom and also the chat on the Facebook Live. We will, this video will be obviously available on Facebook, but we will also put it on our YouTube channel. Somebody wants to know who are the heads of the Joint Finance Committee? I think there's two co-chairs, so maybe.
Yep, there's two co-chairs. Senator Howard Markline, who represents the southwestern portion of the state, is the Senate co-chair, and Representative Mark Bourne is the co-chair on the Assembly side.
And is Dale Coenga still on? He is, right?
Yes.
He's still on the committee?
Yes, he is.
But not a co-chair.
Not a co-chair. Not a co-chair. And if you give me a second, what I will do is go through and post the link to the Joint Finance Committee in the chat so that folks know who is on that committee.
So Lisa is saying something about housing. Lisa, do you want to turn yourself on and tell us what you know about it?
So I'm certainly not an expert on housing things, but as Tammy mentioned, we've been working jointly with the older adult community on where our populations have mutual interest. And so there are some things on housing, again, not disability specific, but there's a new grant that will help to hire regional housing navigators. So I think, you know, that's always helpful in local communities. That's about $600,000 annually. And then the homestead tax credit, which increasing that maximum income threshold, meaning that you don't have to be like super low income in order to qualify for that tax credit, even though you still need to be low income. And then homeless prevention programs. So those are some of the ways that housing is addressed in the budget. Again, I am not an expert on these issues.
And this is Lisa Pugh. She's from the ARC, Wisconsin. She's one of our partners. I too myself did not do a very good intro before I asked her to answer the question. So she's working, we're all working together on these budget presentations. So she joined us a little late, but she is here. And here comes my daughter's 3 dogs down the stairs.
Just about the governor's listening sessions, I am posting a link in the chat so that you can see the dates and topics for each one of those sessions. You do have to register for them. And if you've signed up for our electronic alerts, we will be sending out a message probably today to let people know where to go.
And I did post the the dates for joint finance and the locations. And then I also posted the portal. And I think Caitlin is following up with that on our Facebook Live. So there's a portal to put your comments in for joint finance. So I posted that in the chat too. All right, I don't see any other questions. I'm just looking at the Facebook Live and so we really appreciate you joining us today and giving us all the information. There are 2 other budget presentations. It's the same material, but if you feel like you need to see it again, you can always watch it on our YouTube channel, or that you can participate in the upcoming ones. Just go to our Facebook page for that. All right, I'm just gonna